Hello, my name is Aerts. I'm a urban planner based in New York, specialized in international urban policy and environmental health. Self-contained at home now for 6 weeks since 16 March. And now it's 24 April and New York has installed stricter containment rules 2 weeks ago and is over the peak of registered COVID-19 patients. Nevertheless, the city has become the eye of the pandemic, unfortunately, with more than 11,000 deaths, showing a weak health system and slow response by the United States. At this moment, I think everyone professionally involved into city making is grappling to understand the consequences of this crisis and to take conclusions. But for me, COVID-19 shows clearly that if cities cannot rely on a strong global and local health system, they will have extreme difficulties to continue to attract citizens, economic investment and innovation. And New York and the United States, they are not necessarily showing the example, but fortunately a mega city as New York can rely on its legacy of urban planning, with large parks and fair walkability in neighborhoods that is so crucial now to be able to comply with physical distancing measures. New York is also fortunately still a hub for innovation, international collaboration and knowledge production. So I want to share 3 globally relevant initiatives with you. First of all, there's the Graduate School of Architecture, Planning and Preservation of the Columbia University that has created a fantastic open access reading list called Pandemic Urbanism, Practice in the Time of COVID-19. It has articles from academic and more popular review on the history and theory of pandemics and urbanism, and is very useful to strengthen our knowledge and could be an inspiration for every country. Secondly, there's C40 Cities, the network of megacities that has developed a rich cities and coronavirus portal, which is a curated collection of media and resources on topics that relate with urban health and local practical response by cities. For example, on mass transit and food security. And then thirdly, there's Placemaking X. It's a global umbrella organization of placemakers promoting public spaces in cities as most valuable assets for social connections and local economy. With the almost carless streets and squares, the potential of cities as places for safe and healthy connection has become so clear, so placemakers are ready to design and activate the public space system as a vaccine for urban health. So for me, the COVID-19 pandemic is a crisis not to be wasted, to accelerate bold thinking amongst us and to support governments in developing urban health as a major policy area in the daily management and planning of cities. We need to do this with the health sector because they have a strong science and evidence-based approach, whereas we have a strong area-based instrument approach. And as co-initiator of ISOCARP Community of Practice of Urban Health, I strongly believe it is now the moment for a strong practice of urban health. And ISOCARP can play its role as a knowledge and advocacy platform for healthy and resilient city planning that is people-centered and resonates the broader agenda of the UN SDGs.